Hello everyone, my name is Monica and I am a nursing student here at UNLV. Welcome to my final presentation for Public Health 205 about one current public health issue. Today I will be talking about the current COVID-19 pandemic. First, I will give a brief introduction to coronavirus and dive into the COVID-19 pandemic. I will talk about the pandemic's etiology and pathogenesis, and then I will talk about treatment and prevention methods, and then I will present current statistics, and finally I'll talk about how it differs to influenza. But before we go ahead and talk about the pandemic, I want to give an overview about coronaviruses. When news of the COVID-19 outbreak started, it was first announced as the novel coronavirus and then later announced as SARS coronavirus 2 officially, which to me kind of implied that either this virus was previously unknown or a mutated strain of SARS. But actually, that's just wrong. So, when we get a lot of people thinking this way, I think it creates waves of misinformation, fear, and panic, which is really our reality right now. We are seeing our community grocery stores and factories run out of necessities such as food, water, and paper products. So that's why I think it's important for us to discuss and correct some misconceptions about the virus itself first. So rather than being a specific one, coronavirus is actually a genus name that has hundreds of strains or types, if you will. These viruses were discovered during the mid 1960s and are known to affect both humans and animals. In humans, coronaviruses are usually known to cause respiratory illness. So, as of today, there are 7 known human coronaviruses. 3 of these 7 are considered to cause serious and fatal disease. I've actually put imaging from the NIAID and CDC up here. On the far left, these 3 are the Middle East respiratory coronavirus, and then on the middle, it is the SARS coronavirus, and on the far right, that is the current pathogenic agent of the COVID-19 pandemic. Going forward, viruses are named by the International Committee on Taxonomy of Viruses according to their genetic features. In this case, our virus was identified and given the official name Severe Acute Respiratory Syndrome, coronavirus 2. And the disease that it causes is named by the WHO as COVID-19 or coronavirus disease. Some people might be wondering, why does it have SARS in the name? As I've mentioned earlier, viruses are named according to their genetic features. So the reason why it has SARS on its name is because it is genetically closely related to that 2002 pandemic coronavirus agent, which is just named SARS virus. So again, this does not mean that they're the same or it's a mutated strain. They're just related. So now that the official naming is out of the way, let's talk about the current COVID-19 pandemic. Right now, let's talk about the virus's main mode of transmission and susceptibility as reported by the WHO and CDC back in March. The main mode of transmission for this virus is mainly through small droplets. It is reported to be through direct and indirect route, which means infected individuals can cause to spread this virus when they talk, when they cough, when they sneeze, or when they touch other people. And they can also spread it by touching surfaces or objects and having other people touch it as well. And so when other people touch their faces, their eyes, or their nose, they basically unconsciously put the virus in their system. So now let's talk about who is susceptible to catch the virus. According to current reports, adults, particularly those who are seniors, are the ones most susceptible. These are ages 65 and up, and that susceptibility increases when they have underlying disease or are already immunocompromised, meaning when they have like diabetes, cancer, respiratory problems such as asthma and or other chronic diseases. It was announced earlier that children are also highly susceptible due to their premature immune system, but according to a preliminary research in China, it seems that most children get infected by adults. And now let's talk about the symptoms. usually cases experience symptoms that are similar to the flu, the influenza virus. That's sore throat, general malaise or body pains, nasal congestion, runny nose, and those ones that experience moderate to critical symptoms report experiences of dry cough, shortness of breath, persistent chest pains or pressure, and then some also get that bluish appearance in their lips and or their faces, and also fevers and chills. And next, let's discuss treatment of positive cases. Based on what I read and what has been reported so far, it's really hard to talk about a COVID 19 treatment just because it's fairly new. So, right now, there is no definitive treatment that is specifically laid out for the disease. Experts are still figuring out what is the best course of treatment and medications to combat the virus, but right now, it's usually trying to keep the individual stable by managing the symptoms. So, for those positive cases, they are ordered to stay in isolation depending on how serious their symptoms are. Most of the cases recover at home by doing what they would do when they get the flu. That's getting rested, getting hydrated, taking OTC drugs to manage their fever and other symptoms. But for some cases that experience severe to critical symptoms, they are usually hospitalized and quarantined because they may need respiratory support or mechanical ventilation or have to be watched in case systemic failure occur. As I mentioned earlier, there is currently no antiviral medication or vaccines to combat the virus as of yet. In March 2020, the WHO reported that there are more than 20 vaccines getting developed. So, right now, a lot of private organizations and institutions are laying out potential treatments that can be developed and used to combat the virus. For example, Harvard wrote about a treatment and drugs that have been developed to treat those pathogens that caused previous epidemics. Experts are testing some ones that will be effective against SARS coronavirus 2 depending on how close they are. So just to mention it too from the article, there's the use of convalescent plasma, which uses donated plasma from the recovered patients to make use of the antibodies. And then there's also antiviral drugs that were used from previous coronavirus agents. One particular drug is the remdesivir, and remdesivir is really promising since it was used to fight the SARS and MERS coronavirus. So no one really knows when we'll be able to develop a specific drug or even formulate a vaccine. It may take months or even years. So I think the best course to protect ourselves and our community is to prevent it from spreading further. So for prevention, we should always maintain a social distancing of at least 3 to 6 feet. That's even family or not, sick or not. So, and we should also regularly wash our hands with soap and water, clean and disinfect high-touch surfaces daily, use protective masks or coverings during essential errands, and then of course stay home when you're sick. Cover your cough or sneeze with a tissue or sleeve, and avoid close contact who may be sick. If you have to take care of someone who's sick, of course, always wear protective clothing and like mask, special mask, gloves, and avoid touching your face, eyes, and nose because it could literally be anywhere. And yep, as right now, we should be staying home, staying healthy, and staying informed. So now we're gonna go and proceed to look at some data. Throughout the progression of this pandemic, I have been keeping myself informed and updated about the current trackings and statistics of the pandemic throughout the whole world. And I have been using this coronavirus research center that is managed by the Johns Hopkins University. I believe they update this website regularly, if not daily. So right now, I have the most current update as of May 2nd, 2020 at 1:32 p.m. So we have a total of 187 countries that are affected by the pandemic, and our total count of confirmed cases is at 3,407,983 positive cases throughout the world, and our total death count is 242,270, and that's worldwide as well. And we can see over here on the left hand side that the top 5 countries that has the most cases is the United States, Spain, Italy, the United Kingdom, and France. And then over here at the right hand side, we can see that Italy is the leading country that has the most death at 28,710, followed by the UK, and then France, and then Spain. So, and if we go ahead and go over here at the right bottom side, this shows us a graph. So let me blow up this. So this tracks the reported cases from January 27th to today to April 27th. And so actually it is May 1st. So we came from over 500 from January, and then we experienced that exponential growth or the J curve approximately March 9th, and we have still been increasing, and we have a little staggering up there. So right now we are over there at 3.3 million. So now I'm gonna go ahead and head over to the US map. So if you look at the general map for the United States data, here we are seeing some clusters of condensed cases over at the East Coast, South, and then over here scattering cases in the central part. And this page is actually divided up by county. And if you go over here at the left hand side, Queens, Kings, Cook, Bronx, and then Nassau County, and Suffolk, that's all in New York. Since they're the state that has the most confirmed positive cases and deaths as well. So if you go over here, if you look at the Queens County, they report that there is a total of 51,028 confirmed cases, and then out of that number, there are 3,940 deaths so far. So, and then I also want to show you a really great feature that comes with this resource. And if I'm gonna go and select New York, and I'm going to select Queens since they have the most cases, and I am going to further click on here, and it will show up this window that will take us to a generated report that would give us visuals by demographics and use of insurance, and then some useful data as well. So I'm going to go and click on that. So I really think this is really cool. So I'm just gonna briefly talk about what's on here, what some things that we can look at here. So right now they have reported that 927,438 have been tested, and out of that number, 308,314 have tested positive. And right now we are seeing 24,039 deaths. And right now they are under community quarantine. And right now we are seeing a 7.72% fatality rate. And we can go ahead and head over here on the left hand side that tells us what type of insurance the patients have used. So right now we are seeing on that age range of 35 to 64, they have been using mostly an employer-based insurance, and the 65 and over have been mostly using Medicare and then Medicaid, and then after that they have been paying out of pocket or some private payment, and then the least used one is the VA healthcare. And then I'm sure you can also go ahead and click on the settings here, and that would go into more specific data. And right now, over here at the middle part, it tells us demographics of the cases are. And so if we go over here, it is reported 35.9% of the cases are white Americans. And then over here, Asians at 26.4%, and then 18.5% for blacks or African Americans. And then over here, 13.4% of other races, and then 5% is for 2 or more. So right now we could also look at these data that I think is really useful to kind of engage yourself and inform yourself on current data on specific counties. I'm pretty sure we can also look at some for Nevada, and it's really cool. So I really recommend this resource to keep yourself updated. And now finally, I want to take a moment to discuss the comparison between COVID-19 disease and the flu, since so many people assume and argue it's just the flu because it displays basically all the same symptoms. So we all know how they're the same, so I want to talk about how COVID-19 differ from the flu. First, COVID-19 is reported to have a longer incubation period. This means that it takes longer for infected individuals to display symptoms than it would for the flu, not to mention that some people may be asymptomatic. So, typically with the flu, incubation period is about 1 to 3 days, while it's about 5 for COVID-19. This incubation period was estimated by doctors and experts and have published the article to the Annals of Internal Medicine. This incubation period is really important because it's a factor to gauge the speed of transmission of the virus. And then secondly, it is estimated that the COVID-19 has a longer serial interval. The serial interval is referred to as the time between successive cases in a chain of transmission. In other words, the flu spreads faster than the COVID-19. Now that sounds better, right? COVID-19 is slower. But as reported by WHO, the reproductive number is estimated to be higher for COVID-19 than the flu. The reproductive number represents the intensity of how infectious the agent is, or how able is the virus to spread to more people, if that makes sense. So there's a lot of factors that contribute to this number, but seeing how fast the virus spread in over a span of 2 months, 3 months, I think it's really pretty able. So going forward, fourth, COVID-19 yields more severe and critical cases than the flu. This means that the number of cases that develop severe and critical conditions is much higher for COVID-19 cases. It's worth mentioning that 80% of confirmed cases only experience mild symptoms, but the number for those 15% moderate and 5% severe patients is projected to be more. And then fifth, it's also claimed that the crude mortality rate for COVID-19 will be much higher than influenza. The crude mortality rate is the ratio of confirmed cases to death. I think it's worth mentioning that a number of factors play a role in determining this number, so this claim is not proven yet. And lastly, we know we have vaccines and antiviral drugs and therapies that help us manage the flu better. Right now, for this coronavirus disease, we're kind of just figuring things out as we go. And it's really disheartening that more than 200,000 people worldwide have died, and hopefully we find the best course of treatment for patients soon. So I really think this pandemic is going to change a lot with how we are going to make new policies, make new systems that would work in cases of pandemics and epidemics like this. Hopefully, we are going to be better prepared in the future. I'm pretty sure this won't be the last epidemic in my lifetime, seeing we all know we still have a lot of diseases and infectious diseases that are continuing to thrive in our society. So again, today I talked about the COVID-19 pandemic. I talked about its etiology and pathogenesis, treatment and prevention methods, presented current statistics, and I talked about how it compares to the flu so far. So thank you guys so much. Let's all stay healthy, stay home, and take care.